my opinion, the reason why adolescents choose drugs and alcohol is because when it comes to kids, especially when it comes to the school systems, they don't teach them. They don't teach them, one, who they are, what comes up for you when you're an adolescent, what fear is, what is the emotions behind that. So then they use substances to try to find themselves, try to find that comfort, try to find the peace. Oftentimes, kids don't know where their peace comes from and who they are.
I think people get addicted by just seeing a friend doing it and then their friend saying, oh, come do it, it's cool, or they just think that it's the best thing to do for them and they feel like they shouldn't stop because it's what they want to do.
The age group from 12 to 22, there's a lot going on in the mind. The brain is just forming, the frontal lobes are suddenly kicking on, and executive functioning and thinking is starting to make a lot of sense. And this is where patterns really form in this age group. So if someone's going through a rough time and they decide to use alternative coping skills that are unhealthy for them in the long run, these are the things that they depend on when they become 25, 35, 45, and 55.
Am I a candidate for addiction? There are questions people can ask to gauge whether or not a person has a drug problem. These may not mean that someone is addicted, but answering yes to any of these questions may suggest a developing problem, which could require follow-up with a professional drug treatment specialist. These include: have you ever ridden in a car driving by someone, including yourself, who has been using alcohol or drugs? Do you ever use alcohol or drugs to feel better about yourself or to fit in? Have you ever used alcohol or drugs when you are alone? Do you ever forget things you did while using alcohol or drugs? Do family or friends ever tell you to cut down on your use of alcohol or drugs? Have you ever gotten into trouble while you were using alcohol or drugs?
I mean, I was aware that I was using a lot more. I just didn't care where it took me. And it took me to real bad places, and like ultimately led like some of the worst stuff in my life to happen.
You don't care anyway. They don't care about me, so I'm gonna do what I have to do to make myself feel better. Or they feel like, I tried talking to my mom. I tried talking to my dad. I'm not important enough. Work is more important than my well-being. So I'm going to express myself by substance abuse because I just don't care. They don't care. Why should I care about my life?
They don't know how to experience happiness. They don't know how to experience life without some sort of substance enhancing that experience for them.
Addiction is when a person seeks out and uses a drug over and over, even though they know it is damaging their health and their life.
Some substance or some behavior, some action to get away from what they're feeling inside. Sometimes that's drugs. Sometimes that's sex. Sometimes that's gambling. Sometimes it's cutting themselves. It's always some sort of action that makes them be like, this feels better, or at least feels more present or more real than having to feel the feelings underneath.
Here's my family, we're kind of going in this direction, and before I know it, like, here's the path, and all of a sudden, through a series of decisions and use, all of a sudden I'm over here. Yeah. And it kind of, not that you, did you plot it to go that? Yeah, and it just sort of,
it just happened.
Yeah, just over repetition, all of a sudden it's like, holy hell, like, oh, here I am.
If you're not actively taking care of yourself and taking care of your mental health, then there may be a problem.
I work with kids with a broad range of mental illnesses and addiction. I work with kids who are depressed, anxious, and also just with a plethora of family issues and anything that they're dealing with, whether it comes to schoolwork or or motivational issues, and just the gamut of things.
I describe a lot of the young people that come in here when they start as sort of sticking a cork in the volcano. They don't want to they want to seem fine on the outside, but everything's rumbling inside of them. That giving them permission to get it out, and that we're not going to run away screaming, and that we're going to hear what you have to say, and we're going to try and make sense out of it and help you use whatever that material is to move forward in your life. I think that's what they all want. That's what we all want.